Welcome back to Ethnic Health America. I'm your host, Dr. Mike Lenore. In this segment, we're going to talk to Dr. Damon Francis. We're going to talk about HIV/AIDS. I want to thank you for taking the time to join us.
Thank you for having me.
All right, tell us a little bit about your background, your path to health and HIV.
I grew up in Los Angeles and came up to the Bay Area for undergraduate school at Berkeley, did med school at UCSF and worked at San Francisco General Hospital. And sort of through my time at Berkeley and in medical school, developed an interest in working with underserved populations. And I think HIV provides a really good opportunity to work with those populations.
Remind people, people see the term HIV thrown around a lot. Remind people exactly what the illness is.
The illness is an illness that's caused by a virus, the human immunodeficiency virus, HIV. And it really is a fascinating disease just from a biological perspective because it's primarily transmitted through sex, although it can also be transmitted through blood products. It stays in your body for years, typically, before causing true illness that someone can sense and that would take them to the doctor's office. And that makes it a real challenge to prevent because many people walk around for years having the virus, not knowing they have it, while they're transmitting it to other people.
What are some of the symptoms that people can look to suggest, well, maybe if I hadn't gotten the test I should have already had, I need to go get an HIV test?
If you are an adult between 16 and 64, that is a symptom of HIV.
Okay,
that's what I want to say. You should be tested at least once in your lifetime. About 40% of the population still has never been tested for HIV. Certain populations, the number's higher than that. And really, there's no way to know. As I said, you can go 10 years before having any symptom of HIV. And then at the point that you get sick, you could get sick in any number of ways. Really, the acute infection, the initial infection that you get with HIV is kind of like a common viral infection that you'd have. Fevers, feeling kind of crummy, lymph node swelling. So those kinds of things mean I might have been infected just now, but really just about anything is a reason to get tested for HIV.
When I first encountered HIV, it was in the early 80s. I was living in San Francisco, and they were describing this particular illness in predominantly in gay men, and ultimately went on to become HIV. Then the pendulum kind of swung over the last few years, and the treatment is better, HIV patients are living longer, and the conception now is having HIV is like having walking pneumonia or something like that, that you can just go on and get treatment and everything's okay. That's a misconception, isn't it?
It is a misconception. I think we're doing so much better than we did in the past and we did in the beginning when this had a lot of prominent media coverage, that I think that's the root of the misconception. But certainly it's still a very difficult disease to treat. It still causes a lot of death and a lot of suffering. That's very serious.
Now, when you talk about at-risk groups of people, certainly, obviously, people who are sexually active are at risk. The point that you made is very good. If you're sexually active between a certain age, male or female, you're at risk for AIDS. But it seems like it disproportionately affects the African American community. Why is that?
Well, that's a terrific question. I think because it's an infectious disease, whatever population it gets into first, it's likely to spread more in that population. And I think early on in the course of this disease, the African American population was not a focus of prevention efforts. The disease got spread in our communities through both injection drug use, men who have sex with men who don't identify necessarily as being gay men. And so it sort of got loose in our community, and then only belatedly have we come to recognize that. And now there's this sense that we want to blame it on a certain type of behavior that African Americans engage in, but really it's more the fact that the people African Americans are having sex with are African American themselves, and that population is more likely to have HIV. And so we have this spread of a disease that's already loose in our community, continuing to spread in our community.
Do you think that there's a certain stigma to being homosexual in our communities that precluded so many people from getting tested? Or do you see some of the same kinds of dynamics in all populations?
I think we see the same dynamics in all populations, but I think they are of particular importance in the African American community. I think that, especially outside of the Bay Area, but even here, there is a lot of stigma still associated with being a man who has sex with men, or with having HIV, even if you aren't a man who has sex with men. And we certainly need to overcome that in order to do better preventing and treating this disease.
One of the biggest tragedies of this disease are the incidence in African American women. I understand from the statistics that I've seen, it's among the fastest growing group of people with HIV disease. And a lot of times what I'm hearing is that a lot of women don't want to be identified, you know, as, even if they have HIV disease, don't want to be identified as HIV carriers, obviously because sometimes the partner may not be the designated partner. Are you seeing that rise in African American women?
Absolutely. There's absolutely a rise nationwide in African American women. You know, we have a number of African American women in our clinic just up the street. And it is absolutely a population that's increasingly affected by this disease, but a population that doesn't necessarily think of itself as being at risk, and that the outside world doesn't necessarily think of as being at risk.
Now, the treatments for HIV have gotten better. What is for the general audience? What are the kinds of drugs that we use? Obviously, this is a very fast mutating virus. What kind of drugs seem to be increasingly more effective?
We're using antiviral drugs for multiple classes. In the last 4 or 5 years, we've had 2 new classes of antiviral drugs come out. And the general strategy is to use multiple drugs from different classes to sort of give, you know, a 1, 2, 3 punch. So if the virus can dodge this one with the mutation like you're talking about, it's not going to dodge this other one. And you need to give those medications for life as of this point in time. You know, we're hoping to get to a point where we can eradicate the virus from the body, but that's not a reality right now.
Tell us a little bit about the whole issue of AIDS in young people. Are they more savvy?
No, I don't think so. I mean, I think young people are young people. And as we talked about before, you know, we often want to blame the young people's behaviors. But again, this virus predominantly affects African American communities, poor communities, and so just having sex in those communities puts you at risk, even if you aren't necessarily having more sex or having more unprotected sex.
So what you're saying in essence is that the sexual pattern is not the problem. The problem is the virus is in the community, so even with a similar sexual pattern, you're at much higher risk.
I think the sexual pattern is a problem and is something that we can target and is something that we should dedicate some prevention resources to. But I think there's a misconception that the people who are getting HIV necessarily have more sexual partners or necessarily engage in higher risk behaviors. What we're seeing a lot of in our clinic among the youth is people are actually protecting themselves until they get into a relationship with someone. And they get into a relationship, the condoms come off because we're in love, and the infection actually happens at the point that they're in a long-term steady relationship because they failed to get tested with that partner before they decided to engage in a relationship with higher risk sex.
So your message to our audience is what?
Get tested for HIV, number one. I think we know that somewhere around 1 in 5 people in the United States who has HIV doesn't know they have HIV. We also know that when people find out they have HIV, their chances of spreading the disease go down immediately. People take precautions themselves, we know that. And I think we've focused a lot on you know, shaking our fingers at people and telling them to engage in different sexual practices. And certainly we need to help empower people to protect themselves by choosing the right sexual practices that make sense for their lives. But also we just need to flat out test people, tell them they have this disease, and let them use that information in a way that we know they will.
Dr. Damon Francis, thank you for taking the time to join us. We'll be right back after this break.